Welcome to another episode of the About Mansfield Consumer Advice Series. I'm your host, Steve Casillo, and he is back for his continuing series, Dr. Joseph Adams with Calibration, Chiropractic, and Functional Health. Welcome back to About Mansfield.
Thanks for having me.
Continuing our series on dizziness and vertigo, we got pretty detailed in the last episode. And if you want to hear the last episode or any of the episodes that Dr. Joe and I have been doing, whether it's on migraines or concussions or dizziness, you can go back through Facebook, LinkedIn, or YouTube, or your favorite podcast platform. Continuing the series on vertigo and dizziness, how do you treat the dizziness? Someone has come into your office and they're going, you know what, I know I've got the dizziness. Let's treat it.
Yeah. So, we got to figure out what type it is. And sometimes it's real simple. One thing that comes to mind, a particular story, is that I had a guy that treated for BPPV, which is the one where the stone gets out of place, one of the most common ones. Mm-hmm. And he was at a car show. And, I was just asking him, like, when did all this start? And he's like, well, it was after a car show. And I'm like, well, what were you doing at a car show? And I was kind of thinking about it. And he was like, yeah, I was like looking under all the cars. And I'm like, oh, that makes sense. Because he was like doing this like all day long, like, bending completely over and looking, in weird positions up under cars. And so that's how he displaced the stone. And so for that one, it's pretty easy. You just figure out, which canal it is, where the stone is trapped, and you just put it back, and then they're good. Until they do it again. And so this same guy, now is working on his car and does it again. And then comes back to see me, we put it back, and then, that's how that can go sometimes. And so certain people with BPPV will have it come back, over their lifetime. And sometimes it's the position they put themselves in. And then there's some studies that think it's, based off of just like how healthy they are. Like, people who have certain metabolic conditions may get it more often than ones that don't. So, it really just depends on the type. So we do maneuvers, like the Epley maneuver and other maneuvers for BPPV.
What is the Epley maneuver? What's involved with that? So
an Epley maneuver is where we put a patient on a table and, let's say the table's like this, a long ways in front of me, and their feet are down there, the head's up here by me. And it would say it's the right side that's affected. That stone is in the wrong spot on the right side of their head. And so what we'll do is we'll turn them to that side, which is going to make them dizzy.
Right.
And then we're going to, tilt their head back a little bit. And then we're going to stay there for a period of time, and so that stone can move back in the right place. And then we're going to move them to the other side, so turn their head, 180 degrees. And then we're going to have them turn their body after a period of time and then rotate that head even more. And then we're going to finish the maneuver by having them come up to a seated position with their head turned to the final position, and that should put the stone back into place. So it's a pretty simple maneuver. It just is one of these things that's like an art form. You just kind of have to do a lot as a practitioner to kind of know how to do it the right way.
How common is it for the stone to fall out of place?
Pretty common.
Pretty common.
Yeah, because it's the number one cause of dizziness, of peripheral dizziness.
But it's easy to put back.
It's easy to fix.
And can someone fix it at home?
They can, yeah.
Okay.
If they know which canal it is, you can fix it at home with some YouTube videos.
Okay, cool. Some of the other ways to treat dizziness. What else are, besides putting the stone back in your head?
Yeah, so if it's not the BPPV, then it just kind of depends on what it is. So if it's cervicogenic dizziness, which is where the neck has dysfunction, then chiropractic is great for it. And not just chiropractic, but chiropractic, muscle work, possibly decompression. If it's really bad, let's say somebody who's got extreme degenerative disc disease, degenerative joint disease, then shockwave would be a good option for them.
Describe shockwave. What's going through that? I'm thinking of Shock the Monkey, but that's something completely different.
Yeah, so shockwave actually doesn't use electricity, even though it sounds that way. What it does is send sound waves into the body. The sound waves go about 2 inches deep, and the sound waves hit dysfunctional tissues, joints, and things like that, and it creates this compression in the body, and that compression breaks up dysfunctional tissue, and then your body is going to notice that there's been some inflammation, and your cells are going to come in there and gobble up all that bad tissue, and they're going to start to rebuild you new tissue in that area.
Okay.
And so it's a regenerative approach to healing musculoskeletal conditions. It's non-invasive. It's safe. You can even do it on people who have like metal in their neck, people who've had rods put in their neck or their back. You just can't use it on people who are like on blood thinners or have electrical devices implanted in them.
Is this a device that's called piezo?
Yeah. So our machine is called a piezo wave.
Oh, piezo.
Too. Yeah.
Yeah. Okay.
Yeah.
And then also, I know laser is getting into the chiropractic field. Are you using it to regenerate the cells?
Yep. So we use laser as well, and laser just brings like blood flow, nutrients to cells, and so it improves healing time.
Yeah.
So we use laser as well on some of these cases to speed up recovery or to heal damaged areas. So, like, it really just kind of depends on what they have going on. You know, a lot of times, you know, with the cervicogenic patients, we'll also have them do eye exercises, you know, to retrain their eye and head and vestibular movements. So we can do that with them as well. It really just comes down to the cause. You know, the big thing that people have to realize about, you know, vestibular issues or dizziness issues is it's really just, you know, that your brain is confused. And it's just confused.
I go through that all the time. My brain is confused most of the time.
And so when they're confused, we have to train their brain to not be confused anymore. And the way that we do that is by doing the very stuff that they suck at, right? That their brain can't do, or that their eyes can't do, that their neck can't do it, or that their vestibular system can't do. It's very similar to working out, right? You know, if your goal is to be able to lift like a 40-pound weight off the floor and you can't do it right now, well, how do you get there?
Start with 10-pound weights.
Exactly. That's exactly what we're doing with vestibular rehab for dizziness, is that we are habituating them to do the things that they currently can't do that give them symptoms, in the goal of trying to get them to the place that when they do it in the future, it won't cause symptoms anymore.
Right. Rome wasn't built in a day.
Exactly. And so most of the vestibular conditions, besides BPPV, are going to take time and repetition of therapy to get them better.
Do chiropractic adjustments help with the dizziness and the vertigo? That say you're on a biweekly or maybe a monthly treatment for just regular adjustments. Is it that help?
It can. Yeah, so it can, but it really just depends on, you know, what the cause is. So if it's cervicogenic dizziness, absolutely. Like, you know, getting, you know, adjusted regularly will keep your symptoms at a low level. And so, you know, chiropractic's great for that. And it's a tool that, you know, we use in all of our vestibular and dizziness patients. Everybody gets adjusted. All of our concussion patients get adjusted. All of our migraine patients get adjusted. They don't all get adjusted the same way with the same, you know, force or application. We vary that based off of what we think that they can handle. But chiropractic can help cervicogenic dizziness. It doesn't do as well with BPPV because you got to put the stone back in, right? And you got to know how to do that. And not everybody knows how to do that, chiropractor or other type of healthcare provider.
Going back to BPPV, is there a way to prevent the stone from coming out in the first place?
You know, I don't think they've done a lot of research into that.
No? Okay.
You know, I think that, you know, because we see it primarily in older adults, it's best just to know that if you're an older adult and you have a dizziness episode when you're laying down, that there is a chance that you have BPPV.
Okay. So duct tape and Gorilla Glue, it's not going to help.
Not going to help.
Not going to help.
Yeah, like servo, you know, you put your head in like a neck collar, you know, and like...
In the minute or so we have left, would you like to recap?
Sure. Yeah. So, you know, vestibular dizziness issues are complex. There's many different causes, from cardiovascular to extreme neurological compromise like stroke. And you have to take it seriously when you have dizziness. You should be seen by a provider immediately to rule out any of these other causes that could be life-threatening. But if you ever find yourself in a place where no one can figure out why you're dizzy, then it's time to see a specialist. And that would be, somebody like myself, a vestibular PT, or a neurologist. And so you need to get to the right place to get help.
And if someone wanted to reach out to you, how can they find Dr. Joseph Adams?
You can find us at calibrationmansfield.com or just do a Google search. We're pretty much everywhere.
Calibrationmansfield.com is the web address. That right there is Dr. Joseph Adams, and he is the doctor at Calibration Chiropractic and Functional Health right here in Mansfield, Texas. That is another 10-minute nugget of information, and that is another episode of the About Mansfield Consumer Advice Series. Dr. Joe, let's do it again soon. We appreciate you listening to the About Mansfield Consumer Advice Series. By the way, if you own a business and you are interested in being a part of the Consumer Advice Series, if you have the knowledge to give information in 10-minute increments to the consumers, shoot me an email to info@aboutmansfield.com. Again, that is info@aboutmansfield.com. We'll tell you how we can get you all set up. Appreciate it. We do it again next week right here on the podcast.